The David procedure is one of my favorite things to talk about, I guess, in the realm of aortic interventions, because it's a special procedure that's not done many places in the United States, that few of us have a certain degree of expertise. It's also interesting because it's cited in the aortic guidelines as something that should definitely be pursued if it's available. So it's kind of like pursuing a valve repair as opposed to a valve replacement. Its status is elevated, and its status is actually elevated to the extent that if you have an aorta in a location where you could have the David procedure, instead of 5.5 centimeters, we do it at 5 centimeters. The David procedure is an operation for a particular location in the aorta. The first zone that exits the heart, that first segment of aorta, is called the aortic root. The aortic root's a tough place to operate in general because a lot of things are attached to the aortic root. The aortic valve is attached to it, and the coronary arteries originate from the root. So traditionally, if you have an aortic root aneurysm in that location, you'd be stuck doing an operation called a Bentall procedure. And a Bentall procedure basically has you replace the aortic valve, even if the aortic valve works perfectly. This is just kind of the first operation that was ever conceived for aortic root aneurysm. The David procedure, or valve-sparing aortic root replacement, is kind of what it sounds like, which is a way of doing a much more extensive dissection of the aortic root and basically skeletonizing the tissues that are associated with the aortic valve itself and reimplanting the patient's aortic valve inside the replacement for the aneurysm, which is usually a polyester tube. What's special about that is not only the patient gets to keep their own aortic valve, which is much more likely to last them their entire life as opposed to a cow valve or a pig valve. And unlike a mechanical valve, they won't have to take heavy-duty anticoagulants for the rest of their lives. It's an operation that could literally last them the rest of their life. And you can also perform aortic valve repairs for leaking aortic valves that are associated with aneurysms, which are also pretty common. So all that together makes the David procedure a very preferred procedure for aortic root aneurysm if you're lucky enough to be in a place where you can get one.